Okay. Sir Marco, ano? Okay na tayo? Hello? Hello? Start na tayo? Okay. Alright. Okay, so hello everybody. Welcome to our rationale, exam rationale. I have here the list of questions and the percentage of people who answered the questions on every item on the exam. And I also have the relative percentages on how many people answered wrong, how many people answered correctly. And I'm happy to say na maganda ang nakikita kong ano. Ewan ko lang kay Sir Marco ha, pero ako happy ako sa nakita kong results. Anyways, let's begin with isa-isahin ko ba, Sir Marco? I have to go at it one by one. Okay, so okay. So, bibilis papasada. What we're gonna do is, papasadahan na lang natin yung mga nahirapan sila, nadalian sila, tapos doon tayo mag-focus sa mga nahirapan sila. So, let's start with number 1. Number 1, majority of people answered. 48% of people answered the correct answer, which is good. What is being asked of you in question 1, actually this is question 2. Let's read the question. I'll read the question for you guys. Case presentation. You are working as a research technologist studying the effects of an experimental drug for Hodgkin's lymphoma. Your task was to perform a series of experiments on harvested stem cells for the study. Additionally, samples submitted to the department must be rejected if greater than 50% of stem cell lines are given in the given sample are not stem cells. Okay, so your job for this case is to be a medical technologist. You're not here to be the researcher. Actually, your job is to do the technical work. Okay, so with that in mind, your question is: select the best methodology to determine the percentage of cell lineages in the sample. So anong ibig sabihin nun? Anong hinahanap ni Sir Manuel? So majority of the people answered correctly, and I am so ecstatic. Natuwa ako talaga, Sir Marco, kasi ang hinahanap sa inyo is inaalam kung what we're looking for is your understanding of every methodology that we've discussed, whether it be in hematology or whether it be in immunology and serology. So I'm happy to say that the answer to this question, which majority of you did select, is flow cytometry. Okay, you can't use electrical impedance because the technology is not enough, or that technology is not enough because it's just electrical resistances. How can that methodology tell you what's the stem cell lines, right? It just basically says the granularity and the cell size. Enzyme immunoassays and cytokine markers are both seen in the serum, so you won't be able to quantify the amount of cells in that particular in a particular sample that was sent to you in that laboratory. So that one, so the first question in the exam asks you if you understood the principles. I always have a reasoning as to why I ask questions in my exams. And if you know me, as many of you have already taken, as some of you have already taken my class in the past, when I make my exams, I always have I always ask the question to myself first: what am I testing the student on? In this case, you are being tested on your knowledge of different methodologies. Okay, so I'm happy that you guys are medtechs, and 48% of you, 44.8% of you answered this question correctly. What I am disappointed is in number 2. The second question, I mean, this question. So you guys already know the methodology, right? But still, majority of the people answered, about 37% of people answered the wrong answer, or selected the wrong answer, which is letter A. Majority of you answered this one. If you noticed, the units on this one is not really particular for flow cytometry, right? So we already established that this one is the answer, correct? So I'll italize that one so you guys will remember, and I'll send a copy of this one to Sir Marco, so you guys will have a copy of it and you can muddle through it if you want to. But Question 3, or in this case, the second question, is that it's related to the previous question. Suppose that you've selected the best methodology for the experiment. Which of the following conditions would result in the rejection of harvested stem cell? Now, we have to go back to the previous question. In the previous question, your rejection criteria is this one. The first question has nothing to do with this. This question has nothing to do with that, but it was still given to you, right? Because your next question is related to that one. Suppose you have selected the best methodology. Which of the following conditions best reject the harvested stem cell, or would result into the rejection of harvested stem cells? So in this case, majority of you guys answered this one. If you would notice that the units that I'm using is actually for electrical impedance, okay? And actually, every answer here mimics the units of what is being defined. So enzyme assays would have C3b measured photometrically, because enzyme assays measures it photometrically. This one is CD34 positive cells is equivalent to 27%, 27.8%, and so on and so forth. Okay? So how did we come up with the idea that it's rejected? Because 72.2% of cells are CD38 positive, meaning that they are no longer stem. They don't have stemness in them, right? CD38, if you may remember, is the what? It is the CD marker that determines the stemness of a particular cell. So if you selected this, you are wrong. Very wrong indeed. And Sir Marco, did they already get the results of their exams? Ay! Nakaka-stress! Nakaka-stress! Alright. Next one. Let me look at the percentage of how many people answered incorrectly on the third question. So our third question is, which immunoglobulin subclass of IgG is undetectable in maternal serum? This is a trick question, class. This is a trick question, class. I was only challenging you guys on your understanding of the material. Reading comprehension, class, is the most important skill that you have to learn. Okay? So majority of the people answered letter B, IgG2, when in fact the answer is this one. None of the above. Okay? Undetectable in maternal serum. All of them are detectable in the serum of the mother, right? So why would you say it's undetectable? Why would majority of you say IgG2 is undetectable? Okay, so the answer is, this is actually a trick question. It is none of the above, because all of them are detectable in the mother serum. Okay? All right. Now, we're going to go to number 5. And I think number 5 is the fourth answer, which is, again, majority of people, 29.9% of people answered letter B as well. I'll help you guys in understanding this question a little bit more. This has something to do with our ABO discrepancy results. It's very important that you understand this skill. Again, me being your lecturer always puts everything into the real life perspective. I always ask questions that have real life implications in them, and this is actually one of the things that I've always encountered in the blood bank. Okay? Majority of you guys who've already worked in the blood bank may know how to answer this already, but at a glance, I already know what the problem is, right? Autocontrol is positive. That is the most important thing that you have to remember as medical technologists. Autocontrol should always be negative, because this is also known as your negative control. In some machines, or in some, rather, not machines, but more on ABO kits or ABO typing kits, the autocontrol should always be negative. Why? Because this means that the body is attacking the person's own cells, right? Which is not acceptable. If you release the result like that, you're going to lose your license. All right, but that's the reason why we're testing you guys on this one. So real life implications on this one is, you'd probably see this on a baby. Okay, you'd probably see this on a baby. And the original, the forward typing is pretty straightforward, right? Forward typing. This is your forward typing. Are you guys seeing what I'm highlighting? Just for the class to have a You guys are seeing what I'm highlighting, right? No? Ah, okay. So I'm still highlight. So you guys can still see what I'm highlighting. All right. So the first three bars, the first three columns rather, are your forward typing. Is your forward typing anti-Sierra, okay? And the reactions are as follows. And then you'll see on the second slide, on the second or on the fourth and fifth columns, you'll see this one, right? First of all, what's the problem? There's a reaction, right? If the forward typing indicates that it is a type B person, right? How did we know? And anti A one is negative, anti B is negative, and to confirm that, you have anti AB. Okay, so anti AB is just a confirmation of these two. Okay, every that's a different discrepancy, by the way. If this one didn't react, that's loss of antigen. All right, that's loss of antigen. But anyways, we moving forward, the reverse typing is a little bit fuzzy, right? First of all, the reactions are weak, and second of all, there's reaction on both wells, right? There should only be one reaction. If the patient in the forward typing is type B, the only reaction that you're supposed to expect is the A cells, right? So right then and there, when I saw the positive control, when I put in here the positive control, automatically my mind goes through letter C. So the ABO discrepancy in that case is abnormal serum proteins. Okay, ABO discrepancy, which is actually type 3 ABO discrepancies. Okay, clear, clear. Hope. Okay, we're moving on because I think I only have like an hour, right, Sir Marco? What else per subject? All right. So number 5 is number 6 here. 17% of there's I think 46% of people answered either A or B. Okay, how do we resolve this? As a blood bank technologist, your job is to resolve discrepant result, and one of the things that you need to do is to resolve missing, or rather abnormal serum proteins. And how do we remove abnormal serum proteins? We wash the cell suspension. Okay, we wash the cell suspension. Majority of people answered ABO phenotyping. This is too much, actually. Not a lot of laboratories can do this. It's a little too much. Too much. It's expensive because you have to send a sample from that one. And in most cases of people with abnormal serum proteins, this cannot be done without still washing the samples, primarily because there is going to be a false reaction with even if you do genetic studies. ABO illusion has nothing to do with that one. Antibody illusion has nothing to do with that one because the abnormal serum proteins will still be present in the WBCs. Okay, so your antibody illusion process would just eliminate it from the first wash, but not actually the abnormal serum proteins in the RBCs. Refer to pathologist is stretching too much. Most of the people would answer this one. Most of the people in real life would answer this one, but in your exams, you are considered as a blood bank technologist. Okay? So a pathologist would know that based on your competencies as a blood bank technologist, you would know that the answer is letter C. Okay? You're being expected by the expectations of the pathologist if you were hired as a blood bank technologist is that you won't go and email them about, oh, we need this because this patient has an abnormal result. Although in real life you would still have to refer to that one, but they would expect you to have already done this prior to reaching out through your pathologists. Okay? Now, I think the next question is wonderful. Again, related to that discrepant result. I'm just challenging whether or not you guys know. I think whether or not you guys know what's the problems. So what is being asked here is reasons why why there is a discrepant result. Okay, so majority of people, if I'm not mistaken, since if this is number 6, supposed to be number 7, answered correctly. Wonderful, wonderful, wonderful. So the answer on this one is, of course, letter C. So many people know that abnormal proteins include Wharton's jelly. For your information, Wharton's jelly is an abnormal protein that is present in many newborns' cord plasma, cord blood samples. So they call for us to get the best sample for ABO typing for babies, we would use cord plasma, and Wharton's jelly is a contaminant of blood typing. That's why we only do ABO typing, forward typing for babies because of Wharton's jelly. Additionally, cold agglutinins can contribute to abnormal results or abnormal serum proteins because they react in they agglutinate blood cells at colder temperatures, and if they are present in the patient's sample, most of the time ABO typing or any blood banking procedure is done at room temperature except for cross matching. So you might have a discrepant ABO result in that case. Multiple myeloma, you already know that multiple myeloma. We already know that multiple myeloma is a malignancy. Okay, a malignancy in the lymphoid stem line, specifically the plasma cells. So they would produce abnormal, non-functional antibodies. Passively acquired antibodies. Why isn't this involved? Mainly because of the fact that the correct answer is all of the above. Sorry. That's why I was thinking, huh? Why is the answer C? Okay, so my mistake on that one. It's passively acquired antibodies because you're probably getting something that's contaminating the test. So all of the so for number 6, the answer is letter C. Yeah, I'm looking at it now, Mr. Sir Marco. What was I thinking? I wasn't looking at it. I wasn't looking at it right the answer key. I was just blabbing my mouth. Okay. So where was I? Number 6. Yeah, number 6. All of the answers are correct. So majority of the people answered in this case. So if you're so majority of the people in this case answered letter C. Okay? Which and the answer is letter A. Okay? Next. All of the following are characteristics of an antibody except glycoprotein. Is it a glycoprotein? Yes, check. Does it facilitate phagocytosis? Yes, check. How does it facilitate phagocytosis? The FC portion binds to it, right? And the it opsonizes rather the pathogen, and the FC portion is the one that's considered as an opsonin. This one is detected by macrophages, and they have a specific marker for that one, and this results into the phagocytosis of that particular pathogen. Does it activate the complement in the MBL pathway? We'll talk about that later. Does it neutralize the pathogen? Yes, it does. Viruses are oftentimes neutralized by antibodies. So everything is correct except, there's an answer there. There's an exception there, except for the third one, right? Antibodies do not activate complements through the MBL pathway. Okay, they do not activate the MBL pathway. What activates the MBL pathway is MASP1 and MASP2. Okay, so MASP1 and MASP2 are the ones that are the Mannan-associated serine protease 1 and 2 are the ones that activate your MBL pathway. So I'll underline that one. Next, go to number 8. Number 8, you have another case presentation here with you, and let's see how many people answered the question correctly. Number 8 should be number 7. So a lot of people answered correctly. I'm so happy again. 32.8% of people answered letter C. So the correct answer is this one, letter C, right? Sorry, this one. So a positive cold agglutinin screen. Okay, so you are working as a. Let me read this thing for you guys. So for those people who might have selected the different answer, because there are some people who still answered 18 people answered A. Some people answered letter B. Also 16 people answered letter B, and 11 people answered letter D. Okay, so let me read the case for you guys. For those people for. All right. So let me go again. Let me read the case again. 20-year-old female was admitted to the ICU for atypical pneumonia. Labs reveal congruent results to the diagnosis and is awaiting PCR results to confirm the diagnosis. You are the laboratory technologist working in the rural health clinic assigned to send out the sample for PCR. What preliminary laboratory test would make the diagnosis of bacterial atypical pneumonia more likely? So it already eliminates letter B. This question already eliminates letter B and letter D. Why? Because a negative results in all the test mentions. Why? Because obviously they've seen something in the patient, right? Obviously they've seen something in the patient. Whether or not it's through the x-ray or through physical examination, we're not privy to that because our job is in the laboratory. But what we do know is that if the patient is suffering from pneumonia, these three things, or the cold agglutinin screen is one of the things that you as a technologist should know would be associated with that. Why? Because Mycoplasma pneumoniae can cause atypical pneumonia. Another cause of atypical pneumonia is chlamydia, right? Chlamydia psittaci. Okay? So be mindful of these. Be mindful of those tests. Okay? Next, related to question number 8. Can you guys still see the what I'm highlighting, or is it too much for you guys? Can you guys see what I'm highlighting? All right, let me just go up on this one. By the way, I'm live streaming this one, so if you guys want to review, if maybe Sir Marco has another exam for you guys can still get this one. Now you guys can still review on this one because majority of the time in lectures we don't do rationales, okay? On exam questions. So you guys are very lucky that you guys have a dean that facilitates the rationales for each question. Okay, now related to question 8, so we're talking about cold agglutinins, right? Which of the following conditions best describe the case? Is it Mycoplasma pneumonia infection? Yes, that's the answer, right? What's Marchia-Faba-Michelli syndrome? That is PNH, paroxysmal nocturnal hemoglobinuria. Obviously, we know that multiple myeloma is abnormal serum proteins or abnormal antibodies. Does it have anything to do with hemolytic disease of newborn? Obviously not, because the case does not. Hemolytic disease of newborn is not typical, or is not typically seen in patients with atypical pneumonia. You'd probably see a case with coffee-colored urine in both in the fetus or in the newborn, but but you would never see it in a case with atypical pneumonia. So it has nothing to do with this one. All right. What's PNH, by the way? I think some people might ask what's PNH. Paroxysmal nocturnal hemoglobinuria. We'll talk about that in your in your hematology rationale. Let's go to number 10. Number 10. Related to the case in question, number 28, Donat-Landsteiner hemolysis have been observed in patients with clinical presentation, with similar clinical presentations. Choose the letter that best describes the characteristics of these hemolysins. Okay, so number 10. How many people were able to answer that one? So I'm assuming this is number 9. Majority of people answered, or 85%. Wow, I'm so happy. Okay, good. 57% of people answer, 57% of you, 57%, or rather 57 people answered letter C, which is the correct answer. Letter C nga ba? Parang mali ah. Hoy, hindi yan. Parang mali. Mali ang tinitingnan kong answer. Sorry, mali pala ang tinitingnan kong ano. Mali pala ang tinitingnan kong ano ninyo. But still, I'm happy that 41% pala talaga. 29 people answered, 28 people answered letter A. Okay? Okay. So tama na Sir Marco yung ano, 28%, tama na pala yung ano, naayos na yung numbering. Okay? So 28 people answered this one and 41% of people are correct. They selected this one as the correct as the answer, and which is basically correct. Donat-Landsteiner hemolysins are usually known as your cold agglutinins in the past, but they've used that, but it's no longer the standard the standard nomenclature for that one, which is basically an autoantibody that binds at 4 degrees Celsius with subsequent intravascular hemolysis due to complement activation after exposure to 37 degrees Celsius. Okay? Demonstration of monoclonal gammopathy is not it's not really a test for cold agglutinins. That's more for multiple myeloma. Okay? So see what I'm doing here? It's basically cloning these ones. Okay, demonstrating of abnormal protein that coagulates at 55 to 56 degrees Celsius and dissolves after subsequent heating to 100 degrees Celsius. What's that one? That's Benz-Jones. That's known as the BJ proteins. Benz-Jones proteins. Okay? Benz-Jones proteins. Walang kabastusan, Segi. Alam kong ngumingisi ka na naman. Nararamdaman ko dito, I'm psychically detecting na ngumingisi na naman si Segi. Tsaka si Patrick. Okay? Walang kalokohan, Mike Segi, ha? Alright. Next. Number 11. Plasmodium resistance is associated with what RBC? Random question. Let's see how many people answered correctly. Number 11, 43% of people answered. Yes, very good, people. Very good. The correct answer is P1PPK. That's one of the things that I always teach you guys as part of your mnemonics is although we didn't get to the P1PPK, but for your information, one of the mnemonics is if it's plasmodium, it's PPP. All right, P1PPK. All right. Next, which of the following phenotypes is expected if both parents are AO genotypes? That has something to do with the genotype. Okay, so if both parents are AO, let's go with the Punnett square because I remember that Patrick loves Punnett squares. So this is mother. Okay, mother. Oh wait, I know I can insert a table. How very savage of me naman kung hindi ko alam. Mother, father. Right? Mother, father. So they both contribute A and O. A and O. So both mother and father is type A. Okay? Let's insert a row above. So it could be an AA or you could be a OO. Alright? Let's insert a column to the left. Oops. A column to the right. You could be AO, AO. Right? Okay? And then if you can insert a column to the bottom, or a row at the bottom, you get AA and AO. So sometimes they would ask you questions about how much percentage, but in this case, I don't want you guys to use the math. I don't want you guys to already to die from the math. So 50%, 50%. But it's not. But that doesn't happen. So there'll be a 33% chance of you getting either of these phenotypes. So the correct answer, is type A and type O, which I think many of you got confused. Some of you got confused. Let's see. Let me just double check my answer key. Maybe I'm blabbing my mouth and I'm incorrect. We don't want that. Oh yes, I'm still correct. Okay. So for number 12, it's letter A, and a lot of people were able to answer. There's only 14 people who did not answer that. So kinig tayo ha. Kinig tayo sa mga lecture. Okay? Next. Which of the following blood group systems systems are expected to change as an individual ages? You already know that the individuality blood group, or the I blood group system, is the only one that can change. Okay, ABO, maybe if there is what you call the acquired B phenomenon, but that is a rare case. It's not known for that one. Okay, it's not known. Diego and XG has nothing to do with changes. Okay, in the blood type. All right. Case number 4. Okay, for number 14, it's another case presentation. A newborn from a woman who has had 3 spontaneous abortions over the past 5 years and only 1 live birth experiences recurrent fetal and newborn red cell destruction. Analysis reveals the presence of maternal allo antibodies targeting inherited paternal red cell allo antigens. What is the primary mechanism for the destruction of targeted red cells? So from the case itself, you saw that this patient had 3 spontaneous abortions, okay, and 1 live birth. So there is what you call an exposure. This is what you call the initial exposure. That 1 live birth is an initial exposure. Let me see how many people were able to answer number 14. Number 14. Oh, very good. Very good. Very good. A lot of people were able to answer it correctly. 76% of you know that this is a case of HDFN. HDFN. Hemolytic disease of newborn. I'm sorry, HDNF pala. Hemolytic disease of newborn or fetus. Okay? So, the correct answer is letter C. Okay? Maternal IgG antibody transport across the placenta targeting fetal red cells. Okay? Okay? Is it because of activation? No, has nothing to do with that one. Is it maternal IgG production in response to fetal antigen? No. What we're talking about is the red cell destruction. Okay? The mechanism for red cell destruction. This is talking about the production of IgG, or it has something to do with the exposure. That's why this one is not correct. This is how you get exposed to fetal antigens. Fetal macrophage mediated destruction, I just invented that. It has nothing to do with that one. And this is basically a macrophage mediated destruction of maternal red cells. And obviously, maternal red cells are not the ones that are being destroyed in this case. Hence the term hemolytic disease of newborn and fetus. So if you read it, I think there are some people who answered correctly, who answered incorrectly, and they chose letter C. Let me see. Number 14. Oh, I'm disappointed pala, mali pa. Hindi, hima pala to. Hima pala to, guys. Sorry. Judgmental lang. Sorry. Number 14. There's still a couple of people who selected letter D and letter E. Okay? So this one is just because I remembered Patrick. He likes the spleen so much. Okay? This one is just something that I added to confuse students. Maternal destruction of maternal red cells. Okay? That has nothing to do with that one. HDNF clearly has nothing to do with that one. Okay. So because we're asking about HDFN, HDNF, or hemolytic disease of newborn and fetus. Um, which of the following tests would be the best to detect the condition listed above? Direct Coombs test on father's red cell. Is the father important in this case? I don't think so. Let's put an X on that one. Okay? Direct Coombs test using maternal serum with type O. Indirect Coombs test with mother and newborn? No, I don't think so. Also, what is the correct answer? It's indirect Coombs test using the newborn scored blood. Okay? It's indirect Coombs test. What are we detecting? We are detecting maternal IgG. Okay, we're detecting maternal IgG. And the only way to detect maternal IgG is to do in vitro sensitization, which can only be seen in the patient's serum. In this case, our patient is the newborn. All right. Next, listed from the data above. Let's see how many people. This is this is a this is a pretty easy answer. I'm expecting more than 90% of you be able to answer this one. Might be some outliers, but I'm expecting 90% of you people would be able to answer this next question. Reagents that we use. We don't use horseradish peroxidase. We don't use an iodine. We don't use an iodine isotope, and we don't use cellulose acetate. We use anti-human globulin, or also known as your AHG, or also known as your Coombs reagent. Okay, so I'm expecting people to answer 90% of you. Very good. 89%, little bit disappointed, but if you round it off, it's still 90%. So, good luck. Pat on the back for everybody. Okay? Pat on the back for everybody. Palakpakan kayo dyan, class. Okay, next. Related to the case in number 15, which blood group is notoriously known for causing this disease, causing this condition? Rarely do you see it in ABO and these guys also. Obviously, the reason why we type for RH in the hospitals is because of this case. All right. Next, I'm expecting 70. I'm expecting for number 17, 90% of people also know that. So let's see. Disappointed again, pero pag ni-round off ko naman, Sir Marco, 90 pa rin naman siya. So 85% of people were able to answer that one correctly. None of the people selected MacLeod phenotype. Thank goodness. There was only 5 people who select not 5 people. There was one person who selected MacLeod phenotype. I was just checking whether there's an outlier, and in every class there's always that one outlier. All right. Next, which of the following genotypes can give a person type a blood type O? Genotypes. We're talking about genotypes, class. I've emphasized the importance of genotypes. It's the O one. Why? Because it's amorph and it requires codominant expression, right? Because it's a recessive gene. A is a dominant one, B is a dominant one. There is no such thing as ABO. Let's see if somebody still selected this one. Number 18. 8 people selected ABO. Whoever you are, talk to Sir Marco. Okay? Next. So 80% of the students answered letter D. I'm happy with that one. Okay. I'm still happy because at the very least, I've imparted knowledge to you guys. Wonderful, wonderful stuff. Okay, now, number 19. Which antibody is primarily associated with group A individuals? Which antibody is associated? So you have to go on the deep dive for this one because this one is quite tough. But because we're talking about group A individuals, IgM is the most IgM is the most if you are talking about ABO blood groups, okay? The reason why we do it the reason why we can do it on a slide is because they're IgM and they can react at room temperature. Okay? So always remember, if you're talking about the ABO blood group system, the antibodies that are present in these patients are IgM. So you always have to go on the deep dive in your books, okay? Don't forget to read your books for this one, or listen to my lectures. It doesn't matter. By the way, like, share, and subscribe. Charit lang. Okay? So very good. Majority of people answered this one also. So 27 lang, pero at least hindi man ako nag-expect ng 99 kasi it's a tough question. Some people know it, some people don't know it. But it is something that you should, okay? You should answer because it commonly pops up in the exams sometimes, okay? Which lectin agglutinates A1 cells but not A2 cells or A2 RBCs? Okay? Which germ agglutinin? We didn't discuss anything about that. Concanavalin A, that's something that I just invented. Ricinus communis agglutinin, this is something that I just invented. I just took from Wikipedia. It's going to be Dilichus biflorus. And a lot of people answered that one. I'm proud of you guys. I'm thinking my two daughters answered Dilichus biflorus also. Okay? So I'm happy with that one. Okay? Pat on the back for everybody who answered letter C. All right. Characterizes Kel. What characterizes the Kel phenotype? By the way, this is using. It's not incorrect. I don't know why, but it's British English. Okay, it's British English. So in Great Britain, it's I'm not incorrect in the spelling. Okay, people. Okay, magalit sa akin. Okay. So what characterizes the KEL null phenotypes? Is it the increased KX, the decreased KEL antigens? Is it the increase in KX and no KEL antigens? Or is it those two things? If you listen to my previous lecture about the KEL antigens, you would know that this has something to do with now KX antigens. Okay? No KX antigens. The KX antigen, okay? The KX antigen, no change rather. No change in the KX antigen. The KX antigen is the base molecule, okay? Where the KEL antigens attaches to. If you're a null phenotype, you only have KX. Okay? You only have KX. So there's a decreased expression or no expression of the KEL antigens. The answer to that one is letter C. It's a little tough. We rarely ask that in the exams, but. Okay, so but they always put in those little questions like that. So always be mindful of how null phenotypes from different blood group systems occur. Let's go with the other one. What is the primary function of the Diego systems in band 3 and band 3 antigen? So when you talk about the band antigens, has something to do with the RBC cytoskeleton. Okay? So it's an anchoring membrane. It's actually part of what you call ankyrin. Okay? It's a protein. It's part of the protein called ankyrin. Alright? And Diego blood group system is something that is related to the cytoskeleton. If you look at the literature, Diego system is a band 3 antigen. Okay? Which is a part of ankyrin. It anchors the membrane. Hence, from the name itself, it anchors the membrane cytoskeleton. So that is the correct answer. Let's see how many people were able to answer that one as well. Number 22. Oh, not many people were able to answer that one. Initiates the formation of Diego antibodies. Of course, I would write that just to confuse people, obviously. So majority of people answered this one. Oh, so only a handful, 24 people were able to answer that one. So please remember that band 3, when you talk about band 3, it's talking about the ankyrin molecule. And that ankyrin molecule is the cytoskeletal membrane protein of the RBCs. Okay? You'll also see that in hematology. The lack of ankyrin results to hereditary or decreased ankyrin molecules results to hereditary spherocytosis. Okay. Anyways, let's move on to the next one. We have to do this quick because I only have a couple of hours for you guys. I only have like an hour for you guys. This one. You're working as a night shift MLS in one of the largest OB/GYN hospitals in the Philippines. I don't know what it is. Let's call it labor in Project 4. Okay? A sample of blood from the Rh negative mother and a sample of cord blood from an Rh positive newborn was sent to your bench for stat Rh IgG workup. Given the following data, what is the Given the following data, select the best answer to this question. So, you are being asked about what? Your knowledge of RHIG administration, which is actually a nursing question. But in some, okay, this is an RH administration, RH administration or medication, RHIG medication, sorry. Question. Okay, so we're talking about the mother's, what was this? Mother's weight, newborn's weight, and fetal RBCs counted. Okay, calculate the RHIG vials needed for the mother. So I think I've discussed this, or I think this is part of your notes. Sir Marco, part of the notes that I sent Sir Marco. So you have to understand that this is rarely asked in the board exams, but it still appears. So I want you guys to be knowledgeable of this one. That's why I put at least a one question for this. One item on this one on your exams. I know it's hard to answer, and I think majority of you guys got it incorrectly. Let me see. Majority, let's see, number 23. Yeah, majority of the people answered incorrectly. So let me start by answering the first question first. When you're computing for RHIG medication, you have to know how much is the fetal hemorrhage. Okay, that's the first one. This one is the next thing that you will be able to answer. All right. So assuming, let's go with the RHIG calculations. Oh, hang on a sec. Am I still connected? Because I got a little bit. Is anybody in the chat there to help me out? Can you still hear me? Hello? Hello? I got disconnected. Hello? Dinig pa ako? Kasi sabi nung ano. Sorry. Kasi sabi nung ano na disconnect daw ako eh. Sorry. Anong kaguluhan yan? Double check ko lang ako kasi baka mamaya hindi din tayo nag-ano. Wala na akong moyo ngayon kasi wala nang ano. Double check ko lang ha kasi nag-stream din tayo. Hang on a sec. Okay. Okay na ba? Clear? Is my voice clear? Hopefully it's clear. Inayos ko na dito sa computer. Okay. Send me a smiley face on the chat if you guys can hear me clearly. Hello? Hello? Okay. Send me a smiley face. Wala nag smiley face sa sama. Ayan na nag-send si Patrick, Jose Patrick. Okay. All right. So back to our discussion. This is from the BOC manual. This question is from the BOC manual, by the way. This is the Board of Certification for ASCP. They use it also for, I think they also, the reason why I added this one is that very rarely they would add this to the exams. Okay? So, bago natin i-compute how many vials, tuturuan ko kayo class ng shortcut. Always compute for how much the fetal hemorrhage is. Okay? Class. Binaliktad ko lang siya, class. Doon sa mga talagang nag-aral, you have to compute first fetal hemorrhage. And to compute that, you need to know, you need to do this one. Okay? So, the computation for fetal hemorrhage is is percent fetal cells multiplied by maternal blood volume. Eh sir, paano namin malalaman ng paternal blood volume? Hindi naman siya kasama sa given. Ito ang given namin, sir. Dito natin lagay para makita ninyo. Sir, paano mo masasabi na na alam namin yung maternal weight? Kasi meron kayong maternal weight na given. Okay? If the maternal weight is not given, it's always assumed as 5,000. Okay? 5,000 ml. Okay? Alright? If the maternal weight is not given. But if the maternal weight is given, your formula changes to this. Okay? Fetal red cells. Sorry. Your formula changes to this times, open and close parentheses. Okay? Maternal blood volume. Maternal blood volume is equals to how many kilograms is the mother? Or sorry, maternal weight plus a constant of plus a constant of 70. Constant of 70. Multiplied, not plus. Multiplied by a constant of 70 kilograms. Okay? Now, using my wonderful handy dandy calculator, I'll calculate for you guys how much is the maternal weight. Maternal blood loss. Fetal blood loss in this case. So 1.5. Let me compute maternal weight first. 80 times 70. That's 5,600 times 1.5 divided by 100. So that is 84. Okay? So, percent cellular destruction is 84. Our answer to this one is 84. Fetal hemorrhage is 84. Now, sir, how do I know how many vials I would give the patient? You always have to remember, if you're computing for vials, okay, if you're computing for vials, always remember that that 30% or 30 milliliters of 30 milliliters per volume of fetal bleed, okay, or that means how much volume of blood is being or fetal hemorrhage is happening. There must be 30 units or 300 UG micrograms equivalent to 30 ml of IgG or ROGAM. Okay? Of ROGAM. Following that rule, because our answer is let me put this one for you guys so you guys have a perspective of what's going on. Okay? So fetal red cells, so maternal weight times 70% times 80 that's our complete formula. 80 times 70. Oops. 80 times 70 equivalent divided by 100 because this is 1.5%. That's our given, right? 1.5%. 1.5% red cells. Okay, so divided by 100. So you'll come up with 84. That's the maternal hemorrhage. Okay? Now, since you have that 84, we can use that to compute how many vials we need. So our goal is 84 divided by 30. And with the power of my calculator, 84 divided by 30 is equal to 2.8. Okay? Is equal to 2.8. Sir, meron bang 2.8 vials? Walang ganon. Okay? Walang ganon. So if it's 2.8, and the rule of thumb is plus 1 lagi. Plus 1 siya lagi. Regardless of what the result is. So you already have 3. Okay? 3 vials na siya. But because we have to round off for safety reasons, according to the American Blood Banking Association, you have to round off your result. So if you rounded off the result, you will need 3.0 plus 1. Okay? So the correct answer to that one is letter number 4. Okay? And by the way, this question was copied off of the previous that's because I can't come up with this question on my own because I don't like computing. Alright? I don't like computations. This actually was copied off of the American Blood Banking Association review guide for medtechs who want to specialize in in blood banking. Okay? So, sir, meron pa palang additional test doon? Yes, there is. Okay, now how do we determine so we already solved this one already, right? This one is how do we compute for fetal hemorrhage? So I just wanted to confuse students who actually read their books. I know, so evil. I know, Sir Marco, ang evil ko. Binaliktad ko siya. Because originally, you have to compute this one first. Okay? Before I ask you how much are HIG vials. That's the reason why I think a lot of people were unable to come up with a good answer because I'm confusing them. Vials muna, bakit kailangan 'di ba dapat ito muna? Part of the challenge is that you have to compute the fetal bleed or the fetal hemorrhage in the mother's blood. Okay? So, with that in mind, we were able to solve this one using this formula. Okay? Alright? If you compute it, and you may, if you want to dispute me, that's fine. You can compute it like this. Alright? That's the formula. This is the formula because the weight is given. If the weight of the mother wasn't given, always assume 5,000 ml. Okay? But if it's not, 70 kilograms. You have to use a 70 kilogram factor. Okay? Now, let's go to the next one. Related to the previous number 25, how do we determine the percent of red cells? Do we do immunoelectrophoresis? No. Do we do flow cytometry? No. We use we use flow cytometry pala. Sorry. We can use flow cytometry. Yes. And yes. For Kleihauer-Betke. Traditionally, we use Kleihauer-Betke, which is using acid to destroy other red cells except for fetal red cells, and we do account using your RBC pipettes. But because the hospitals right now are equipped with technology, most of the time you will see flow cytometers in larger hospitals. So the answer to number 25 is letter D. Okay? The answer to number 25 is letter D. So a lot of people were able to answer that. 50.7% of you guys were able to answer that. I'm happy that majority of you guys know that. RHIGG is administered to whom? The mother, the father, or the newborn? Or the mother, the father, or the newborn? This is another question that is considered to be a bonus question for you guys. Hopefully, majority of you answered. Let's see how many people answered. Yes, very good. Very good. At least nobody answered father. Okay? At least nobody answered father. I would still accept it. It's still, for me, it's understandable that some people might have selected the newborn, but if they selected the father, something is wrong there. I might question my teaching skills if somebody still answered father. Okay? So, pwede pa rin ako magturo, Sir Marco pala. Okay? So, next is, in terms of molecular weight, which of the following has the highest molecular weight? This is a trick question. Obviously, I'm still asking about IgM. Let's see if somebody considered answering C3. Number 27. Somebody no, so nobody answered the C3. Very good, very good. I'm so proud of your students, Sir Marco, in this class. Oh my gosh. Okay, so IgM is the highest one. Actually, if you look at it in Google, this one is about 180 kilodaltons. 180 kilodaltons. Okay? So, which of the following is the least antigenic? Leucine amino acid chain, a steroid molecule, glycosamine glycans extract, or UUC codon. So, this is basically protein, obviously, or an amino acid chain. This is what? This is a lipid. And this one is what? Glycosaminoglycan. This is a carbohydrate, carbs / protein mix. Okay? This one is our answer. Our correct answer. Why? This is nucleic acids. This one is a nucleic acid. Why? Uracil, cytosine. Okay? This is a codon. Okay? So it's a nucleic acid. That's the correct answer. The least antigenic. It's asking you who's the least antigenic. Alright? Which of the following cells of humoral immunity is affected by multiple myeloma? We've mentioned multiple myeloma. I think my favorite disorder in this batch is multiple myeloma. Obviously, you guys know that this is associated with the malignancy of plasma cells. Okay? Related to number 30, what abnormality is present in patients with this case? Lack of hypersensitivity to antigenic stimuli, lack of humoral response to antigenic stimulation by cytotoxic T cells via chemotactic molecules, malignant effector cells in the bone marrow that results to hyperproduction of abnormal immunoglobulins. That is the answer that we're looking for. This is malignant effector cells. Spontaneous autoimmune response is something that you would consider for somebody with SLE. Okay? And then is an immunodeficiency probably with patient infected. This letter B is probably an infection, is a characteristic or the mechanism in HIV or the HTLV. Okay, hypersensitivity to antigenic stimuli is an allergic reaction. All right. Which of the following cells is an APC? What does APC stand for? APC stands for those people who don't know, antigen presenting cells. Okay? Dendritic cells is the answer. You'll see it all over the body. Okay? All over in a lot of tissues. Eosinophils? Nope. Squamous epithelial cells in the small bowel? Nope. They might be surrounded with APCs, but the squamous epithelial cells, they are not antigen presenting cells per se. Mast cells is another name for your tissue basophils. Okay? Alright. Which of the following is a form of passive immunity? Getting a vaccine. IgG antibodies from the mother crossing the placenta. Recovering from an illness. Passive immunity. Passive immunity, which means that you did not actively produce it. Okay? You did not actively produce the immunity. Okay? So, the answer from that one is IgG antibodies crossing the placenta. Sir, bakit hindi pwede kasama getting a vaccine? Because it didn't involve what type of vaccine. Because there's several types of vaccine. Live attenuated or antigen. What's an example of an anti-antigen, sir? Anti-rabies is an example of that one. Anti-tetanus toxoid. Okay? So I didn't say what type of vaccine, right? So obviously this is not the best answer, right? So it's the antibodies crossing the placenta, because you, if you say passively, you didn't produce the antibodies. In some vaccines, you're the ones who would produce it. Sometimes they would give you a vaccine that is actually antibodies, but that's not the correct answer. All right? Recovering from a viral illness is a form of active, okay? An active immunity. Okay? And again, I didn't mention what type of vaccine you got. So most of the time, you would get a live attenuated one. Sometimes you would get an mRNA vaccine, which is one of the which is what is which is what is being popularized right now. And recovery from a viral illness. Obviously, all of these are not the same, so you can't answer D. So let's see if some people answered. Let's see if some people answered that question. Okay, so majority of the people answered correctly. I'm still happy with that. 152% of the people. So so kaya pa nating magturo, Sir Marco. Hindi pa tayo hindi pa tayo hindi pa tayo mahina, Sir Marco, sa teaching game. Okay? So, this is the rarest of all blood types, characterized by the absence of the common antigen, resulting to a production of anti-H hemolysin. Inetros ko lang kayo dito, class. Dinagdag ko lang anti-H hemolysin. Anti-H lang actually yan talaga. The answer to that one, and I think majority of you would answer number 34 as the Bombay phenotype. You are correct. Some people still selected the wrong answer, but I'm still happy that majority of the class, or 80% of the class, answered Bombay phenotype. Okay? Ini-adjust ko lang kayo dyan, class. Dinagdag ko lang yung anti-H hemolysin para maloko kayo. Okay? This is formerly known as anti-TJA, and it's a product of what phenotype? This is number 35 is what? It is a number 35 is letter A, the P phenotype. Okay? That's the P antigen, the small P antigen rather. Okay? Related to number 35, what is the current nomenclature for this one? It is the anti-P1-PPK. Okay? Alright, it's anti-P1-PPK. You see, class, the answers that sometimes I would just add this just to confuse you, just to confuse my students and see if they still understood some of the lesser known antibody producing phenotypes. So small p phenotypes formerly have this one labeled as the antigen it produces, but because of advancement in genetic and molecular biology, they were able to map out that it is actually from the P1-PPK, the PP1-PK antibody. All right, let's move on to number 37. DTT, treatment of red cells results in the artificial synthesis of what phenotype? What is DTT, by the way? What is DTT? Medyo mahaba. Babalikan ko yung notes ko saglit. Nasaan ko nga ba nilagay yun? DTT. Medyo mahaba yun. For your information lang, DTT. Medyo mahaba yun. What was that again? There we go. Dithiothreatol. Dithiothreatol. Let's go and put it here. Dithiothreatol. Tama ba spelling ko? Oh, thank you, Google. All right. So treatment of RBCs with this one is results in the artificial synthesis of CelNal. Okay, what's the importance of but why do we need to make anti-kel, why do we need to make CelNal phenotypes? Because we want to detect the anti-kel antigens. Okay, we want to detect anti-kel antigens, and the only way to detect that is through the use of anti-CelNal RBCs or reagent CelNal RBCs. Okay? Lack of glycophorin A and glycophorin molecules results to a lack of, let's see how many people remembers the glycophorin A and glycophorin B. Number 38. Let's see, number 38. Oh, disappointing. A lot of people answered. A lot of people answered. A lot of people answered RH antigens. It's not the RH antigens. Disappointing. Correct answer is letter C on this one. And oh no, a lot of people answered KEL antigens. My mistake. The correct answer is the MNSSU antigens. Okay. Remember that these two are anchoring molecules. Okay, they are anchor molecules that pass by that are present in the RBC membrane. Okay. Next, another case presentation. Patient has a positive antibody screen and a positive antibody identification panel. All of the test cells are positive with 3 plus at the Hg phase reactivity. The autocontrol is also positive. So from this one again, from this terminology again, you would know that this is an auto-absorption. But what type of auto-absorption? Is it allo? Is it just auto-absorption? The regular one. We need to know. The patient has not been transfused or pregnant in the preceding 6 months. That's also an important indication. Okay? What technique would be used to complete the case or to solve the case? You need to do warm autoabsorption. What is warm? Sir, what's the difference between warm and cold autoabsorption? So cold autoabsorption is basically when you're testing for cold agglutinins or abnormal proteins. That another one, which is done when you have antibodies against anti-IA, anti-P, those things. Warm autoabsorption is what we do when something has an autocontrol positive, especially at the AHG phase. Okay? What does it do? It absorbs it. It absorbs the antibodies that are present, and it allows us to identify what it is. Why? Because once it's bounded to our reagent cells, when we repeat the antibody panel, we'll be able to get a clear picture of what's going on. Because this one is completely ridiculous. This line over here is completely ridiculous. All test cells are positive at 3 plus at the AHG phase. That's the reason why we need to do autoabsorption and not cold absorption or alloabsorption. Okay? No further testing required is something that will get you to lose your license in the blood bank, especially if you're working in the Philippines. They're very litigious about although, especially if that happened to a rich person, by the way. Anyways, let's move on to the next one. Enough about my gripes about the jurisdiction there or the medical practice there in the Philippines. But anyways, let's move on. Number 40. A lot of people were able to answer this question, I think, correctly. Oh no, disappointing again. Disappointment. Only 29% of people were able to answer correctly. Okay, so what did many people answer? Adsorption elution techniques. Kasi yun yung naalala ninyo sa akin. Okay? So a patient with sickle cell anemia who was transfused with 2 units of red cells 2 weeks ago at another facility goes to your transfusion service for the first time. The clinician is requesting phenotypically matched red cells. What serologic technique can be used to obtain the patient phenotype in this case? How do we know? We're identifying the patient's phenotype, by the way. This is what we're identifying. We don't really care much about the other blood types of these 2 donors, right? We don't care about these. We want to eliminate these. Okay? So this 2 transfused blood cells. So let's say I want you guys to picture transfused or donor cells. Let's go with donors. Donor cells are healthy. Okay? Sickle cell disease patients are unhealthy. Their cells will survive longer, but will not survive hypotonic solutions. Because they're already at their maximum tonicity, right? These ones will not survive longer. And will survive with a wide variety of tonic changes. So ano ibig sabihin nun? Ibig sabihin nun, kasi this one is microcytic hypochromic class. I-relate natin sa ano. The more na dinadagdagan natin siya, kasi the more resistant siya, kasi it's smaller. The cells are smaller and they are practically dehydrated. Okay? This one, donor cells are hydrated. The tonicity is normal. Therefore, if you change the tonicity, it will explode. And if you use a hypotonic solution, these cells will be lysed. And therefore, you can determine the true RBC phenotype of the patient. Okay? Because remember, because this case is from another transfusion service, you, as part of your job as medtechs, you still need to do ABO typing and RH typing, and you can't do that if there is contaminants from the two red cells that were transfused 2 weeks ago. Okay, kaya important yung detail na 2 weeks ago kasi it will survive longer. Class, it will survive longer. If the patient was just there unhealthy and she didn't get transfused, then you can type as usual. Fesin and adsorption elution techniques are useless in these types of things. Why? First of all, absorption elution detects bound antibodies. Okay? Fesin removes antigens. So, ano mangyayari? Magkakaroon ka ng false reaction dyan sa dalawang yan. Okay? So, the most important thing that you need to remember is that donor cells are healthy, they survive longer, but will not survive hypotonic solutions. Sickle cell patients, on the other hand, are unhealthy and therefore their cells will not survive longer and will therefore survive but because they are dehydrated and smaller because of their microcytic hypochromic nature, they will be able to resist longer when subjected to a hypotonic environment. Okay? Next. This one is, I'm proud to say this one is the only question that you guys have that came from an AI, that came from ChatGPT. Okay? So I entered the data and I saw a lot of things, and Sir Marco was asking me about this a couple of hours ago because this one looked probably it flagged in his brain that it looked weird because it is weird. Okay? And I wanted to be like that. I wanted it to be weird because it's asking about because it's from ChatGPT. Make a question about wrist. Okay? All right. So, what ChatGPT wanted to confuse you guys with is that this one is myeloma protein. Okay? Myeloma protein is basically AHG, and that's how they manufacture AHG nowadays. Okay? So all you need to remember is in everything is that because this is radio immunoassay and this is radio immunosorb and this is radio, which means we're using an iodine we're using an iodine label, iodine 125 for your information. 120 iodine 125 for your information. Oops, 125. Okay? Iodine 125 as the isotope. This is the correct answer, by the way. Alright, so all we need to know is that is it a competitive assay or is it a non-competitive assay? So obviously it's not a non-competitive assay because you are detecting the antibodies. That's why it says immunosorbent. Okay? If it's allergosorbent, which is RAST, this one would be the correct one. This one would be the correct assay. Alright? This one also would be the correct answer. Oh, sorry, not this one. This one. Oh, no, no. None of them are correct answer. So this one is for Rast. This one is the principle for Rast. This one is the principle for Rist. These are just confusion. This is just confusion of the highest. This is just confusion of the highest order. Alright? So this is the correct answer. Okay? Alright, now let's talk about Graves' disease. Okay, which of the following statement accurately describes the mechanism underlying Graves' disease? So what I'm testing you guys here is what? Antibody identification or antibody blocking. Autoantibody receptor activation versus autoantibody receptor blocking. Right? We've discussed that in our previous discussion, and I think this is very important. Now, what's the correct answer on this one? Did anybody answer correctly on... hopefully, a lot of you guys answered because I put extra emphasis on this one, including myasthenia gravis. Let's see number 42. How many people? Oh my gosh, I'm so proud of our students, Sir Marco. They answered letter C. Oops, this is letter C. They answered letter C correctly. Okay? So majority of the people answered letter C, which is Graves' disease is caused by an activation of the TSH receptors by antithyroid antibodies, leading to hyperproduction of the thyroid hormones. Okay? So it has nothing to do with the inhibition of TSH receptors, leading to reduced production. Graves' disease anti-TSH receptors introduced. So basically, it's just characterizing myasthenia gravis. Okay? Let's go to the next one. How do IgG antibodies produce protection in newborns? By promoting complement fixation, through opsonization of pathogens, by participating in agglutination precipitation reaction, by crossing the placenta, and provide passive immunity. Obviously, the answer to that one, I think everybody would know that one, I think. 43% of people answered letter D. Very good. IgG is the only immunoglobulin class among the 5 that we discussed that is capable of protecting newborns. Okay? So we're talking about newborns. Can it still do complement fixation? Yes. Can it still do can it still opsonize pathogen in newborns? Yes. But I'm asking about newborns, okay? And how they do that, and it's asking you how. It's asking you how. If it asks you why, then you can answer these 3, okay? But it's asking you how. So it asks, provide. So a lot of people are reading are good at reading comprehension, Sir Marco. Okay. Now, when using VDRL plate shakers, what settings are typically modified for venereal disease venereal disease research laboratory test? Low speed, short duration on plasma, high speed, long duration on CSF plasma, variable duration with a constant speed depending on whether it's plasma or CSF. No modification is required for VDRL plate shakers. There is an answer to that one. If you read your books, you would see that there is constant 180 RPMs. I actually added this, I think, to the exam, to our test, to our slideshow presentation. But what is different is the amount of time. 8 minutes for plasma. 4 minutes for plasma, and 8 minutes for CSF. Okay. So that's the only reason. And the answer to that one is, of course, letter C. Let's see how many people were able to answer that one. 44. Yay, very good. I think they're believing ang pinakamahabang sagot, yun ang tama. O nga naman, tama nga naman. Alright. In FTABS, to remove a cross-reactivity which non-pathologic strain of Treponema pallidum is commonly employed. We often use, what do we use, class? What do we use? What's the correct answer? No strain of FT. Let's see how many people answered correctly. Number 45. Number 45. So, the correct answer is the writer strain. And 44.8% of people were able to answer. I'm still fine with that one. So, some people are still reading their books. Okay. How do IgG antibodies contribute in the protection of... I think there were two answers. Yeah. So, this is basically a bonus for you guys. So, crossing the placenta to provide passive immunity. Just a repeat. Next. Anti-P1 antibodies are commonly observed in individuals with which of the following conditions: bird handlers, patients with Hyatid disease, cyst disease, Babesia microti infected individuals, or both patients with who are bird handlers and patients with Hyatid disease. I think the correct answer is this one. Okay? Remember, anything that has something to do with parasitology, my mnemonic for you guys is P. P. Parasitology. Okay? Which of the following blood group system is based on the numbering system, and do not use specific letters for identification. Let's see how many people were able to answer this one correctly. Very good. ISBT. I love it. I love it. This one, DCE. This one is the minus one. This one is the 1, 2, 3 designation. Okay? Next. Magaling ang mga students. Okay, number 49. Sir Marco, malalaman ba natin dito kung ilan yung pumasa? Gusto ko malaman kung ilan yung pumasa. Hindi natin malaman kung ilan yung pumasa. Okay. Nakalagay lang kung ilan yung percentage. Hindi ko naman gets yung ibang variable, Sir Marco. Pero sige, mamaya na lang natin pag-usapan. Anyways, nasa na tayo? 49. A lot of people weren't able to answer this correctly. And what is the autoantibody formed by patient undergoing hemodialysis, and what is the primary cause of its formation? Has something to do with formaldehyde exposure. Okay. So sorry, not formaldehyde. It's a chemical. Formaldehyde. Yeah. Formaldehyde. Okay. So patients who are exposed to formaldehyde can produce anti-N, auto-anti-N, which is the correct answer, by the way. Alright, so if you're exposed to that one, what would happen when you get formaldehyde into the bloodstream? So what happens is the other MNSS molecules will be stripped off by formaldehyde and exposes and it removes the N antigen. That causes the body to produce auto-anti-N. Okay? So that's one of the weirdest occurrences in a clinical setting, and that's the reason why they always do DAT or direct AIT or indirect antiglobulin testing on patients who are undergoing hemodialysis because of this phenomenon, and it rarely occurs. Now, the RHAG or the RHAG gene codes for a specific CD designation. I added that because I think you guys are reading the books, reading some of the stuff that I'm writing for you, reading some of the stuff that I sent you guys. It's 241. Okay, let's see how many people were actually reading their material. Oh, disappointing. There's only a couple of people who answered correctly. There's only 9 people who answered correctly, but don't worry. That's just 1 point. All right. Frozen phenomenon is eliminated by incubation, dilution, elution, or centrifugation. Dilution. Okay. How many people answered correctly? Let's see. Number 51. Disappointing as well. A lot of people answered letter C. But paborito ninyo class ang elution class, ha? In-explain ko naman sa inyo kung ano ang elution class. Kayo talaga, ha? Ito, ang ginagawa lang natin dito, pros have an excess of antibodies. And in order for us to do that, we need to dilute the sample, and specifically using serial dilution. Hoy, class, ha? Kayo, ha, class? Niloloko nyo ako, ha? Puro kayo illusion, ha? 51. Illusion ang nagsagot. Maraming nagsagot ng illusion. In fairness, hindi nila sinagot centrifugation. In fairness naman, Sir Marco, bigyan natin sila naman. Aggregation of soluble antigens is known as precipitation. Very good. Alam na nila yan. So, majority of the students answered that one correctly. In RID, agarose gel is incorporated in, what is RID? Radial immunodiffusion. By the way, RID is what they used in the books. So I just copied this off of a book. And is it incorporated with either with what? Antigen, antibody, complement, or anti-human globulin? Let's see how many people answered first. The correct answer is letter B, by the way. It's incorporated with antibody. Okay? And majority of people answered AHG. I find it weird. Class, antibody is supplied in the agarose gel. And what your specimen has is antigens. Okay? So I do not understand why you guys chose AHG. Very wrong indeed. Okay? Identify the precipitation pattern. My gosh, class. May picture pa tayo nito, ha? Kayo talaga pag kayo hindi kayo nakasagot dito. 54. Hi! 16 lang na tao ang nakasagot. This is non-identity. Okay? Kalimutan nyo na class ko ano yung tinuro ko sa inyo. If it's partial identity, it will have a spur. Mawawala yung isa. Okay? If it's non-identity, if it's identity, if there's complete identity, if there is identity, you will have an arc. Okay? There is no arc. Okay? So therefore, this is non-identity. Okay. Which of the following, so sorry. Lagyan natin ng ano. Arc, formation, arc. Partial identity is spur. Huh? Ganun lang ano. What? There's no such thing as cross reaction there. We don't know. We can't tell. Okay? Huh? Kaya ko, ha? Alright. Let's move on to the next one. Number 55. Disappointed ako dito, class, kasi binigay ko sa inyo yung picture. Kayo talaga, ha? May video pa kayo, class. Sasakalin ko kayo. Number 55. Number 55. A lot of people answered D, which is correct. All of the above. You can use these as carrier molecules or particulate antigens to perform agglutination. Okay? Very good. A lot of people were able to answer all of the above. Okay. Permanent deferral is given to prospective blood donors taking what? Aspirin, diuretics, Accutane. Aspirin, you can wait after a week. You can wait after a week. Diuretics have no effect. Accutane, if the donor is if the recipient is a pregnant woman. Tegison is something that you should not give somebody for that one because it alters because it's a chemotherapy drug. Okay, you don't use the chemotherapy drug. If you're undergoing chemotherapy, do not take that person as a blood donor. Okay, next. Common reason for transfusion with leukocyte poor. I think a lot of people were able to answer Tegison, number 56. No, nobody were able to answer Tegison. They all answered aspirin. Aspirin is just a blood thinner. You can still donate actually if it's RBC pheresis. But anyways, let's move on. A lot of people were able to answer. You need to remember Tegison, okay, class. I think it wasn't donor selection wasn't part of our discussion, but it was still included in your in the list of things that you needed to study. Okay, common reason for transfusion with leukocyte poor blood is that the recipient has to be what? The common reason for that one is that the patient has febrile non-hemolytic transfusion reaction. Okay? So you remove the leukocyte poor blood. You remove the leukocytes in these patients. Okay? If they already have, because why? Because they might have anti-leukocyte antibodies, and which causes the febrile non-hemolytic transfusion reactions. Okay? Okay? What is that one? Let me transfer febrile okay. Next. Common signs Lagyan natin ng rational pala. Kaya pala, nga pala rational nga pala tayo, Sir Marco, no? Anti anti-leukocyte antibodies causes fever spikes on patients. Okay. Common signs and symptoms of delayed hemolytic transfusion reaction are all of the following except hemoglobinuria. Let's see how many people were able to answer number 58. Nobody answered. Oh no. There's only 4 people who were able to answer number 58. 6 people rather. Majority of them answered jaundice. Class, delayed hemolytic transfusion reaction is intravascular, not extravascular. So, and it's also delayed, so you won't see hemoglobinuria because the body will already have it's a slow type of hemolytic transfusion reaction. So you won't see the hemoglobin pour out of the patient's urine because the threshold is balancing out the kidneys are balancing it out. Okay? So you would expect jaundice and anemia and fever but not hemoglobinuria. Okay? Kasi nga lumalabas kasi hindi naman lumalabas normally kasi nga nako-conjugate ka agad. Kumbaga. Okay? Preferred storage time and temperature for platelet concentrate. Patay tayo. Hopefully I have students who have answered this one. Very good. 55% of people answered letter B. That is the correct one. But we have to have a special storage requirement. What's the special storage requirement? It requires constant freezing and thawing. It requires constant agitation, class. Okay? Requires variable heating to between 10 to 20 degrees. That's just something I made up. No special storage requirement. Just store like whole blood products, which is a big no-no. Okay? I had an intern do this to me last when I was working in the blood bank, and that intern that intern got a demerit. Anyways, let's move on. Referred to as the antigen determinant site, epitope. A lot of people were able to answer this one correctly, I think. Yeah, epitope. So we're not gonna delve deep into that one. 61. Yeah. We're not gonna delve deep into that one. In reporting and interpretation of serological results for syphilis, the correct terminology is what? Positive, negative, indeterminable, positive, negative, reactive, non-reactive, weakly reactive, or we use the numerical reporting with units. We don't use numerical reporting. That is for the physicians to see how much the infection is. That's the reason why it's reported. Okay? But to be understandable by the general population, we report it as reactive, non-reactive, and weakly reactive. Okay? So 62. A lot of people were able to answer that one. 80% of you guys were able to answer that one. Incompatible blood transfusion is what type of hypersensitivity reaction? I think a lot of people also answered that one correctly. So we're not gonna delve deep into that one. Disappointing to I'm a little bit disappointed to the 40-something people. To the 37 people who answered incorrectly. But the rest of the class were. But 29%, the 29 people were able to answer. So that means that I won't quit my job yet until in teaching. Okay, very good. Now, medyo naguluhan ng mga tao dito. Okay? Immunoglobulins found in the surface of B cells. Medyo naguluhan kayo dito, class. IgM and IgD lang. Okay? Chill lang kayo. Anong klaseng IgM? The monomeric one. Okay? Pentameric ang usually, di ba, sa labas. Meron tayong monomeric ayun. Nandun sa notes nyo yan, class. Kayo talaga, ha? Tsaka sa lecture. 65. Which of the following cells... Balikan natin. Which cell functions antigen processing and presentation. Pinag-usapan na natin kanina, these are your phagocytes. So, therefore, this includes your macrophages. Okay? Clear? Macrophages. I'm just double checking. Please send me a smiley face if you can still hear me because nobody's speaking. Medyo nakakalungkot pala yun nandyan sa loob ng Sir Marco. Medyo nakakalungkot pala kasi hindi sila masyado nagre-react. Nalungkot ako, Sir Marco. I like the live I like our previous lectures before. Anyways, let's move on. Ang purpose lang naman ni Sir Marco dito is para kutsain kayo. Charit lang. Para may matutunan kayo. Well, Felix reaction is used for the detection of which pathogen? Tuberculosis. Do we do that? No. We use two things. In serology, we use what? We don't do well Felix. For tuberculosis, we do what? We do the skin test, right? What's the who here knows the skin test for tuberculosis? You can type it on the chat. Cryptococcus, we use what? Neufeld-Keeling test. Why? Because it Neufeld-Keeling test. Capsular swelling or a capsular swelling test. How many people were able to answer this one? Neufeld-Keeling. Let's see, number 66. Number 66. Oh, a lot of people were able to answer rickettsia. Never mind then. Neufeld-Keeling. Okay? So, tuberculosis, ano yung ginagamit natin na test? MAN2 test, di ba? And for treponema, obviously, we do VDRL or RPR. Okay? Next, what blood type is or possible for an offspring of somebody who has offspring of heterozygous A and B parents? Ayan naman tayo sa heterozygous. When we say heterozygous, this is your phenotype. So, for example, pabalik na naman tayo sa Punnett square. Tuwan-tuwa talaga si Patrick dyan sa Punnett square na yan. I'm not sure if Patrick is there. If Patrick is there, please send me a like emoji. Okay? Saan na ba yan? Insert table. Okay? So, mother, father, okay? A, B. Do we need to know? No, we don't need to know what their heterozygous is. Which one has A and B or heterozygous A and B, right? We can determine it already. So A, O, B, O. Umpisa na naman natin yung Punnett square. A, B, O, O, diba? A, O, B, O. See? So, C class. So, ano mga blood types na nakikita nyo? A, O, A, B. Diba? So, ito ang tamang sagot. Diba? Nag-Punnett square lang tayo. There are 3 to 4 cells forming small agglutinates amidst the many free cells. This pattern is known as natural loop formation. Let's see how many people were able to answer this question. This is from the what was that book that I took it from? That pink book. I forgot that pink book. Shula. Yeah, Shula. I got it from Shula. 68. Not a lot of people were able to answer this one correctly. It's not Relu formation. Relu formation is stacking of coins. Agglutination is basically a clump. And that's small agglutinates. Okay? Aggregation is large chunks. Diba? Yun yung mga definition natin, diba? Pag mixed field, yan yung tamang sagot. Ano ba yung mixed field? Free-flowing yung ibang cells. Pero may mga maliliit na nagdidikit-dikit. Okay? Yun yung free-flowing. Yun yung mixed field. 3 to 4 red cells. Okay? Why is it important that you guys need to know what a mixed field finding is? It's because if you're doing or you're confirming that there is actually a +1 or +2 reaction that for example, you're using gel techniques. You want to confirm your cross matching, right? And in order for you to do that, you have to do the tube method. Okay? If you don't know how to do the tube method, you're in trouble. So that's one of the key skills of a medtech who works in the blood bank. Pseudo-agglutination is another thing that you need to be familiar with. I think we didn't discuss this, but I added this one just in case. This one can be tested with the DAT. Why? Because you are testing agglutinates or the in vitro process, right? So in order for you to identify it as pseudo-agglutination, you need to do direct antiglobulin test to see if there is actually antibodies attached to the red cells. And a lot of people answered illusion again. Talagang gusto-gusto ng mga students ang illusion. Hindi ko alam kung anong meron sa inyo. Bakit gusto-gusto ninyo ang illusion class? Ano ba? Kayo talaga class, ha? Okay. You can't use saline also because if you use saline, you'll wash off the unbound. You'll wash off the. No, I mean, it's part of direct agglutination technique. Okay, so that's basically it. Okay, so next, let's go to the presence of platelet-specific antibodies. I think a lot of people were able to answer this one. Yeah. So, post-transfusion purpura. All of this are related to bleeding except for this. Are not related to bleeding, rather. These are all not related to bleeding except for post-transfusion purpura. So, it's good that a lot of people were able to answer that correctly. 26 people out of the whole class were able to answer that one correctly. And I'm happy with that one. And I don't think I have to discuss that one. Platelet-specific antibodies basically attack the platelets, causing purpura. What is purpura? That is Latin term for bleeding. Small little bite-sized pieces of bleeding. Okay? Febrile hemolytic transfusion, nothing to do with specific platelet antibodies. Urticaria, nangatika, that is non-hemolytic also. Trali, transfusion-related acute lung injury, that has nothing to do with that one also. Okay? So, let's go to the next one. This is described as a biphasic hemolysin seen in patients with cold hemoglobinuria. Number 71, the answer is letter C. Tandaan, class, lahat ng may kinalaman sa bacteria, parasites, and everything, and paroxysms, anti-P, laging may P. Okay? Yun ang lagi kong ina-elaborate sa inyo. Kasi in the board exam, they will keep on asking you about P. Kasi wala silang ibang matanong. Okay? What component provides concentrated source of fibrinogen? Answer is fresh frozen plasma. What is in cryoprecipitate? Factors. Okay? Factors. What's in platelets? Platelets. Okay? What's in packed red cells? RBC siyempre. Diba? So in fresh frozen plasma, what we find is fibrinogen. Okay? Sir, akala ko, bakit sir, factor din naman ng fibrinogen, factor 1. Wag charotera, factor, ibang klase, syempre, ibang factors aside from fibrinogen. May fibrinogen din yon. Pero, hindi yun ang main purpose ng FFP. Okay? 72. Okay? Next. Source of 80% of air. Ay, sorry, baliktad pala ako. Sorry. Fresh frozen plasma is for factors. Mali ako. Kasi natataka ako bakit namali ata yung numbering. Okay? Baliktad tayo. Dito yung fibrinogen. Okay? Next. 80% of errors in the blood bank are caused by blood mismatch, delayed transfusion reaction from undetectable alloantibodies, clerical error, testing error, like contaminating polyclonal antisera with used pipettes. Correct answer is clerical errors. Let's see how many people were able to answer. Number 73, very good. We don't have to discuss that one. In your books, you will also see that 90%, actually more than 80% will say clerical errors. Related to number 73, the most efficient way of eliminating errors that originate from the previous statement is Regular competency training of the blood bank staff, having a position in the blood bank, having a position of blood bank quality control officer, implementing blood bank LIS that is fully integrated to the machines in the blood bank, termination and revocation of license of a staff who committed errors. Obviously, this is not going to be your answer. If somebody answered that one, I am going to have a stroke. Okay? Let's see. Did somebody answer? Oh my gosh, letter D. 6 people answered letter D. Sir Marco, bumubula ang bunganga ko. Sir Marco, bumubula ang bunganga ko. Somebody answered this one. I-revoke ka agad ang license, Sir Marco. Sir Marco, nai-stress ako. Sir Marco, grabe. Bubula din ang bunganga mo, Sir Marco. May 6 na tao. May 6 na tao na sumagot. Kailangan kong malaman kung sino yung Sir Marco. Papakulam ko yon. Kukulamin ko, Sir Marco. Nakakagigil kayo, ha? Charing lang. Love ko pa rin kayo kasi nasagutin niyo yung mga common sense questions. Alright, next. Kasi meron tayong student last year, Sir Marco, may siya nag-iisang sumagot ng ano. Kaya na-miss ko Google Forms. Mas gusto ko Google Forms, Sir Marco. Nagagalit ka. Nakakagalit, no? Gusto natin mababa. Dapat, charing lang. Oo. Sige. Ganyan na lang ulit. Sige. Mas maganda pala ganito. Which of the following immunoglobulin is best at fixing complement? Siyempre, kung sino yung pinakamarami, di ba? Ano ang tamang sagot? Tingnan nga natin kung meron pa rin sumagot ng iba. Nanggigigil talaga ako sa inyo, ha? Kayo talaga may sumagot pa din ng ano? May sumagot pa din ng IgM. Kayo talaga, ha? IgG yan. Kasi yan yung kumakapit. Di ba nga kaya nga may FC portion, doon sila kumakapit. Opsonizing portion. Or complement. Ang shortcut ko doon, pag sinabing FC, doon kumakapit yung complement. Hindi siya, for me, I call it, for me, I usually say it's a complement portion, not the crystallizable fragment. Okay? Although all of them has that one, but IgG has the strongest one, has the ability to do that because it reacts, complement reactions usually occur at 37 degrees Celsius anyways, what blood type is not possible for an offspring of somebody? None of this. Okay, inulit lang natin yan kanina, di ba? Di ba ang tamang sagot A, B, and none of this ang tamang sagot. Tingnan natin kung meron na namang namili ng ano. Okay. Majority of them naman answered. Meron sumagot ng C. Sasakalin ko talaga kung sino sumagot ng C, ha? Which of the all of the following constituents, all of this can decrease the storage time for 21 days in CPD except for potassium. Ano ba ginagawa ng potassium? Pasasabugin niya yung red cells mo, di ba? Kayo talaga, inechos ko lang kayo dyan. Number 77. Tingnan natin. Ay! Grabe, may sumagot ng may mga sumagot ng iba. Naloka ako sa inyo. Alright, anyways, let's continue. Confirmatory test for HIV, Western blot, Northern blot, hemagglutination inhibition. This is, by the way, for influenza. Okay. Immunobid para sa anti-sperm antibodies yan, ha. Northern blot, walang ganon sa sir. Wala tayong ginagawang ganon. Molecular technique yan. Western blot ang ginagamit natin. Okay? Detecting GP120 and Paul. Okay? Paul. Ay, GP40 din pala. GP40. Kasi GP120 and GP40, when you combine them, they're collectively both known as GP160. Any positive result in any positive line, or if you're using a densitometer, any positive line on this one or any of these ones would confirm your results. Okay, what does Western blot do? We detect the actual proteins in the HIV molecule or the virion. Okay? So walang takas yung virus doon. Any positive result on any of those will render your results confirmed as positive. Okay? Terminally differentiated. The terminally differentiated form of an antibody forming cell is binago ko lang ang pangalan nito. Terminally differentiated form of an antibody forming cell. Tingnan nga natin kung maraming sumagot nito ng tama. Number 79. Medyo disappointing na 53% lang ang sumagot, pero at least alam nila na ang tamang sagot ay plasma cells. Antibody forming cell nga di ba? Magpo-form ba ng antibodies yung mga yan? Yung iba dyan? Ibinold ko na para sa kanila. Alright, severe intravascular hemolysis is most likely caused by antibodies of which blood group system? ABO. Alamin nyo na yan. Ngayon pa lang. 80. Marami namang sumagot ng tama. Pero disappointed pa rin ako kasi 55% pa rin. Doon ako nalulungkot kasi meron pa rin 30 people na nakasagot ng mali, 'di ba? Which is very wrong indeed. Okay? What antibodies are produced by the Bombay phenotype? Anti-A and B only, anti-A only, anti-A and B only, everybody. Of course, if you're not Bombay phenotype, your phenotype is small h. Okay? Small h. The amorph one. Right? That's the antigen that you're presenting, which is the amorph one. H is the original antigen. And if you're H null, you produce anti-H. Therefore you are producing anti-H. Okay? Would I still be producing anti-A? Yes, very much so. Will I be producing anti-B? Yes, very much so. Pero paano ba natin nalalaman na isang tao ay Bombay phenotype class? Kasi magta-type siya initially as type O kasi wala naman siyang magre-react siya with both this diba? With both anti-seras. Mawalan siya ng reaction with both anti-seras pala. Sorry. Mawalan siya ng reaction with both anti-sera. So, ang mangyayari is, ang patient na to, if you're type O, if you're type O, you won't react with those. No. You will react with those. You will be typed as AB. Pero, hindi ka nagiging compatible with your AB people with 100% of the blood bank's supply of AB. So magtataka ang doktor. Magre-request tayo ng anti-H ngayon. Kasi ang patients with Bombay phenotype, they are uniquely anti-H. Okay? Positive. Alright. Blood group associated with HLA antigens. This is more on memorization work, memory work. Correct answer in number 22 is the Bennett Godspeed. Makikita ninyo class, if you look at your HLA types, you would see BG1, BG2. Ibig sabihin ng BG1, BG2 is Bennett Godspeed antigens. Okay? Yun yung mga HLA typing antigens sila. Okay? The discovery of vaccines were based on cowpox virus having similar or close antigenic determinant to that of smallpox. Cowpox genes are closely related to smallpox. The modification of the cowpox virus to help human host build immunity against cowpox. All of these are true. Let's see how many people answered. All of these are true. Patay. Ang daming sumagot ng all of these are true. This is the only one. Okay? They're not closely related with each other. They belong to Pax viridae virus, but that's the only closeness that they have. Okay? Nobody was still able to modify the cowpox virus at that time. Kaya nga madaming namatay dyan. Okay? If you're good with your history of vaccination, they share close antigenic determinants. Okay? So genes and modification of the cowpox virus was still unknown to people during the discovery of this one. They just know that the antigenic determinants are similar to cowpox. So they did that using variolation. Okay? Next. The classical pathway of the complement cascade starts with, of course, formation of C1QRS. It won't start with MAC because MAC is the product of the complement cascade in all pathways. MBL is the start of mannose binding lectin pathway, and this one is for your alternative pathway. Okay, so let's see if people answered a lot. If a lot of people answered 84 correctly. Very good. Very good, very good, very good. There are some outliers, but what can we do? Okay? Mixed field agglutination in ABO typing is an indication of severe sepsis, previous transfusion, genetic variant. How many people were able to answer D? Very good. Sir, bakit severe sepsis kasama? Kasi nga yung remember we have cross reaction between some bacteria. Okay? And some bacteria can cause cold agglutinin formation. So kaya kasama siya. Okay? To the recipient siya. Sorry, mali yan. Okay? Thawed FFP must be transfused within 24 hours. Okay? Let's see how many people were able to answer correctly. 86. Oh no. Medyo malungkot ako. Less than 50% ang nakasagot. Okay? There's only 21 people who answered that one correctly. 24 hours class ha pag FFP. The immunodominant sugar for type B RBCs is N-acetyl-galactosamine, N-acetylglucosamine, C-fructose, D-galactose. Tinamad na ako dun sa CND. Obviously, ang sagot dyan is either A or B. Which one is it? Let's see how many people answered first. A lot of people answered B and C. Tinamad ako sa C. Gusto ko lang magdagdag lang A lot of people answered N-acetylgalactosamine. Or glucosamine. It's actually just galactose. The immunodominant sugar is galactose. We're talking about the immunodominant sugar. We're not talking about the whole molecule. So, galactose is the correct one. Alright? Kaya talaga class ha. Naloloka sila sa sir? Sa hindi na ako gagawa ng mga or gagawa pa ba ako ng mga ganun, yung mga palaisipan, Sir Marco? Napansin ko parang naloloka sila pag ginawan ko ng mga palaisipan eh. Okay, mali. Mali ang binibigay na ko. Sorry. The product is galactose. But the immunodominant sugar is galactosamine. Okay. Next. Immunoglobulin reacts best at 26 degrees Celsius. This is room temperature. Cold agglutinin. Galactose. Tama. Sorry. Sa ko kasi, answer key ko kasi immunodominant sugar ang sinasabi ko. Sorry pala. Mali. This is the whole structure. Right. Nagulat kasi ako. Bakit sabi ko, ba't parang iba yung galactose nga din na sinagot ko eh. Ba't parang hi. Nung nakita ko yung yung answer key ko, ay, hindi. Galactose yan. Immunodominant sugar ang tinatanong eh. Not the whole structure. Sorry. Tama tayo doon. Tama tayong dalawa doon, Sir Marco. Una. Nagulat lang ako nung tinignan ko doon sa ko. Bakit Anyways, let's go with this one. Immunoglobulin that reacts best at 26 degrees Celsius IgM. Okay? What else? I think everybody answered 88 correctly. Yes, very good. 89. Which of the following is a non-specific organ? Systemic. Ayan na, sinulat ko lang systemic autoimmune disease. Answer to that one is letter B. Very good. Very good. Okay. Which of the following, a lot of people were able to answer. Galing-galing ng mga students pala, Sir Marco. Nakakasagot naman pala sila ng tama eh. Which of the following antibodies are of most use for the diagnosis of pernicious anemia? Antiparietal cells ang sagot ng mga students. Ewan ko na lang kung may nagsagot pa ng anti-nuclear ha. Ewan ko na lang. 90. How many people were able to answer that one? A lot of you guys. Very good. Walang sagot, wala tayong dalawa yung 90 natin. So ito yung sinasabi na dito Kaya pala parang merong lapse dun sa Yes, very good. Okay. Defect in neutrophil NADPH production produces what? Chronic granulomatous disease, Shiajaki-Gashi disease, leukocyte adhesion deficiency, Hashimoto's disease. Ine-etchos ko lang kayo dyan, class. Chronic CGD yan, class. Okay? Huwag kayong maniwala sa akin. Ine-etchos ko lang kayo, class, dyan sa mga tanong ko na iba. Yung iba dyan gawa-gawa ko lang. Meron bang leukocyte adhesion deficiency kayo talaga, class? Ano yan? Kung nakinig kayo, narinig nyo yan na ano yan, na chronic granulomatous disease yan. Okay? 90% of females have this blood group. Very good. I think a lot of people were able to answer this one. Tingnan nga. 91. Very good, very good. Hindi ako nalungkot. DiGeorge syndrome is a defect in which one? Bone marrow, thymic anomaly, DNA repair, or CD complements? Or CD3? Or, bakit may point? CD lang yan. Kala ko complement. CD yan. CD3. Walang ganon. Okay? Gawa-gawa ko lang din si number 3. DNA repair. That's a different disease. Bone marrow production is obviously aplastic anemia. So, your answer should be thymic anomaly. Okay? Okay? DiGeorge syndrome. AIDS is only becomes a diagnosis if HIV, ito ang mga important. Remember, AIDS and HIV/AIDS is a topic that is close to my heart. Kailangan nasagot ng mga students ko to na marami makasagot dito. More than 50% dapat makakasagot dito kasi sasakalin ko kayo. Andali. Number 93. Kailangan kong tingnan. Number 93. Ay, very good. Natutuwa ako. CD4 cell reach below the lower threshold. Very good. Most predominant type of antibody in the human in the serum, IgG. Let's see how many people answered correctly. Very good. Hindi ako disappointed sa class na to, Sir Marco. Hindi katulad last time. Tingnan natin sa hematology kung madi-disappoint ako sa kanila. Which of the following serology results indicate that the patient has been vaccinated? Ay, naku. Dito tayo nagkanda-loka-loka sa numbers. 17% lang ang sumagot ng tama. Okay. So, ito ang ano ko sa inyo. Bibigyan ko na naman kayo ng para mabilis ninyo maalala yan. Kasi isa sa mga questions ninyo yan. Although, that's supposed to be a pathologist's job. But, ganon. Okay. Para hindi sila mahirapan. Okay. Ano to? Patient has been vaccinated, no? Ay, hindi nasama yung subscript na C. Ito yung gusto ko pa check kanina, Sir Marco eh. Pero anti-HBC yan. Pero hindi naman siya kasama dun sa may ano. So, we won't remove that, Sir Marco, diba? And no... Okay. So, usually sa exam, ang tinatanong lang naman is carrier or infected. Acute infection. Ay, sorry. Acute infection / carrier. Ano nga yun? Ano yung isa? Vaccinated. Ah, hindi pala. Ito pa. Vaccinated and carrier status. Minsan dyan magtatanong sila ng recover, sir. Kaya dagdag na nga natin. Very rarely ko siya nakikita kasi. Recovered. Para hindi mahirapan ng mga students natin. Okay. Acute infection. Magiging IgG to. IgM. Okay. Pass. Neg. Okay? Vaccinated, neg, pass, neg. Carrier, pass, pass, pass. Recovered, negative, pass, pass. IgG, IgM, and IgG. Okay? So, di ba, nakita nyo, oh, kung vaccinated ka, hindi ka naman na-infect, di ba? Therefore, negative to. Okay? Kung recovered ka, nawala na siya na-clear na siya sa serum mo Pero very rare to ha, in rare instances lang to ha. Rare instances. And they don't usually ask this in our board exams. Okay? Pero just for your information, pwede yung ilagay dyan. Okay? So, ito, carrier, lahat positive. Okay? Lahat positive. Kasama pa yung IgM and IgG. Saan ba nakikita to? Sa liver lang to Okay? Pag umabot na hanggang liver, alam nyo na kaagad yon na nagkaroon ng infection yung pasyente. Okay? Pero pag vaccinated ka, anti-HBs lang. Kasi ang binigay sa'yo yung antigens lang. Okay? Paano ba usually dinidetect to? Molecular studies na ba kaagad, sir? Serology. Okay? Usually through ELISA. So, hindi na detect yung HBsAg molecules. Ang dinidetect natin usually is ito. Okay? So, kapag kayo mapasok kayo ng internship, di ba, ito ang hinahanap sa inyo. Di ba? Ganon. Okay? Clear? Clear kayo dito, ha? Kasi ang daming mali. Maloloka ako sa inyo. Charit. Okay? So, ang tamang sagot is non-reactive this one. Non-reactive, reactive, carrier. Non-reactive. This one is the correct answer. Okay? Non-reactive, reactive. Recovered. Okay? Infected. Unclear kung ano siya. Unclear if acute or chronic. Kasi wala namang indication ng IgM or IgG. Okay? 96. Lapit na tayo taas. Suppose that the patient is having an acute infection. What is this indicative of? The patient was indeed infected by the virus. IgM is the predominant immunoglobulin in the bar. Both are true, none are true. So the correct answer is, tingnan muna natin kung ilan yung tamang sagot. Ilan yung sumagot ng tama. Let's see how many people answered correctly. 96. Okay, both are true. A lot of people answered correctly. Very good. Okay. Now, related to the previous question, how is the diagnosis of chronic infection made? IgM and IgG are equally reactive in the serum. IgM is the most predominant. Chronic infection. IgG, anti-HBC, is predominant in the patient's serum with reactive results for HBsAg. Ang pinakamahabang sagot, yun ang tama. Tingnan natin. Oh, di ba? Next, which of the following is not part of our innate immune system? DPT, vaccine, diphtheria, pertussis, tetanus. Okay. All right. So let's see how many people were able to answer that one. Innate immune system, ibig sabihin hindi ka pinanganak na may ganun. 98. So tama naman karamihan. I'm so proud of our students, Sir Marco. True or false? Oo. Sumagot naman sila lahat, sir. In fairness naman sa kanila. True or false? Meron, sir. Maraming sumagot ng false sa number 99. Sasakalin ko kayo. Hemolysed samples are rarely seen as an issue in many serological tests. Hoy, nakakaloka kayo. False kayo dyan. Hoy, true. Kayo talaga nakakaloka kayo. Paano kung anak mo? Ano naman to? Most lectures for MLS programs to be taxing because of work or study. True. Tama naman. Nakakaloka. Dinagdag mo pala yan. Yung pala yung dinagdag mo. Kinulang ba ako ng 100? Nakakaloka kayo, class, ha? Alright. Pero at least, proud na proud ako sa kanila, sir. Kasi, compared sa previous batches natin, Sir Marco, nagustuhan ko yung ano. And take note, hindi pa to Google Forms, ah. Gusto ko to. I love this. Sige, sige, sige. Hemolyzed samples are rarely seen as an issue in many serological tests. Class, hemolyzed sample daw, hindi daw siya issue. Hindi siya issue. Rarely. Hindi siya nagiging issue. Very rarely lang natin siya pinapansin as an issue. Wala, ibig sabihin, lahat ng karamihan ng ibig mm, mm, true nga. 'Di ba? Eh ano lang naman ba ang test na ano lang naman ba ang test Sir Marco na ano? Ah, binaliktad false class. Ano ba kasi isa lang naman ang test na kailangan natin ng result na may ano complement fixation lang naman, 'di ba? Karamihan 'di ba ano na? 'Di ba Sir Marco? 'Di ba? Isa lang naman yung merong test sa ano kaya rarely ayan oh. Hemolyzed samples are rarely seen as an issue. Oh, 'di ba? Kayo talaga students. Naloloka ko sila sa ano Sir Marco no, sa ano tawag doon sa by technicality naloloka sila sa technicality. Isa lang naman ang issue na ano ha, 'di ba? Complement fixation lang naman. O lagay natin para ano, complement fixation. Tagalog na ha, complement fixation lang ang ang may kailangan ng positive ng hemolysis as an indicator of the result. Ayan ang Taglish. Kasi hirap ako mag-Tagalog, Sir Mark Charet. Alright. Okay, so tapos na tayo doon na. Clear ba sa lahat? May question ba ang iba? Maghahanap tayo ng question. Wala, nako, tapos magagalit kay Sir Marco, bakit binagsak? Ay nako. Walang question ha. Move on na tayo sa next, Sir Marco. Oo. Bigyan natin ng 30 minutes na break. Okay lang ba? Makakaabot ba tayo sa HEMA? Matatapos ba natin yung HEMA? Pagka ganun. Okay. So, tuloy na natin. Oo. Papaspasan ko yung mga ano. Hindi, ano yun natin. Mga 15 lang kasi kakain din ako saglit. 15 lang. Oo. Walang questions ha. Pag may questions, pwedeng i-type sa akin, ma'am. I-type, pasend doon sa mga kaklase na naka-online ngayon. Okay? Okay? Pag may questions. Alright.